The United Nations says Pakistan is facing a health emergency after the worst floods in decades, with hundreds of thousands of people living in makeshift camps with no clean drinking water. The UN has dramatically increased its appeal for aid, saying it needs more than $800 million to try to control the spread of disease. In many areas, the floodwaters have still not receded, and it's feared there could be serious food shortages. Our South Asia correspondent, Rajini Vaidyanathan, reports from Sindh, the worst affected province, and a warning her report begins with some images you may find distressing.
Struggling to breathe. Noor is just 6 years old. Her brother Ali has carried her to the village centre. Running a high fever, she's soaked in sweat and has malaria. One of thousands of children stranded in flood-hit areas. Noor's been waiting for medical help for days. Now, Dr. Amara Gohar is treating her.
I have given her antibiotics and paracetamol for fever.
So she needs to go to hospital?
I would advise them to take them to the hospital.
But for Noor's family, that's a challenge. Large parts of Pakistan remain underwater, including hundreds of hospitals. Dr. Amara's delivering medical care by boat. Part of a team of government doctors supported by UNICEF. We asked if we could join them as they travel to remote areas. In this stricken village, every child we meet is sick. 3-year-old Gulbahar's covered in scabs. His mother tells us the only water he can drink or wash with is filthy. And that's led to desperation. Families scramble as the team share bars of soap. Something so basic, a lifeline against infection. One thing that's been striking as we've been going around with Dr. Amara today is just how many people in these cut-off communities are still struggling to get proper food and access to clean drinking water. And it means that Dr. Amara is seeing more and more patients who are malnourished. This stagnant pool which surrounds them swallowed their crops and is now making them sick. As mosquitoes multiply in these floodwaters, so do the diseases they bring. At another village, Dr. Amara and her colleagues have set up a mobile clinic. They measure baby Saima's arm. She's malnourished. Since the floods, her mother's struggled to feed her. If this sort of camp didn't exist, what could happen to people in these communities?
If we do not provide our extra facilities to them, they cannot survive.
For every child that gets help, there's another in need. Pakistan's government's accused of not doing enough, but it says that without more international help, this could become a humanitarian crisis for the history books. Rajini Vaidyanathan, BBC News, Sindh Province.